welcome to another exciting episode. I'm Shao.
And I'm Simran.
Nice to meet you guys. Today we'll be sharing with you an example OSCE on the topic of jaundice. To follow up with the example OSCE, it will be followed with a breakdown, analysis, and a couple tips on how to approach this topic. So today, Simran has kindly volunteered to be the student doctor, and I will be representing the patient, Nicole Jones, as well as the examiner. So firstly, I shall read out the scenario. Nicole Jones is a 36-year-old female who has noticed that her eyes have begun to turn yellow. You are a third-year medical student at the Alfred Hospital, and you have been tasked to take a history and answer any follow-up questions from the examiner. So Simran, you have 6 minutes approximately to take a thorough history and 2 minutes approximately to answer any follow-up questions.
All right, awesome. Hi, Nicole. My name is Simran. I'm one of the medical students at the Alfred. How are you going?
I'm going okay.
Well, nice to meet you. I'm just here to just ask you a few questions about what's been going on, and everything that we discuss will remain confidential. Does that sound okay with you?
That sounds really good.
Awesome. So I understand that you've noticed that your eyes have turned a bit yellow.
Yeah.
Can you tell me a bit about that?
Yeah, around about 3 weeks ago, I've noticed that my eyes is starting to turn yellow, and I know my kid's telling me that too.
Okay. And have you noticed this anywhere else apart from your eyes?
No, it's really just both my eyes.
Okay. And did this come on suddenly, or was it gradual?
I think it was gradual because I don't remember the day that I started noticing the eyes becoming yellow like this.
Mm-hmm. So it's just a progressive thing. And has this happened to you before?
Never.
No. Okay. So apart from the noticing that your eyes have become yellow, do you have a fever?
No, I don't think I'm feeling hot or cold or anything.
No. Have you noticed any sort of changes in your appetite?
Oh, yeah, I have. I'm starting to eat a lot lesser.
Yeah.
Yeah.
Okay. And that's also been going on over the past 3 weeks?
Yeah, it's been going on for about probably around the same time.
All right. And have you been feeling nauseous?
Yeah, it's because I'm feeling so nauseous,
Yeah.
That's why.
Okay. And have you vomited?
No, I feel like I'm going to, but I haven't.
All right. And have you noticed any sort of pain in your tummy anywhere?
Well, actually, now that you mention it, I'm starting to get all this like uncomfortable feelings underneath the bottom of my right rib.
Okay. And that also started about 3 weeks ago?
Yeah, like 2 to 3 weeks, yes.
All right. So it's underneath your right rib.
That's right.
Can you describe what kind of pain it is?
It's definitely uncomfortable.
Mm-hmm.
Yeah, it's it doesn't feel like a sharp pain as such at the moment. It's getting a little bit worse, but definitely there.
Okay. So if you were to rate it on a scale of 1 to 10, how would you rate it?
Sorry, like 10 being the worst?
Yeah, 10 being the worst.
So if 10 was the worst, I'd rate it around 5 on the discomfort scale.
Okay.
Yeah.
And does this pain come and go, or is it constant?
That's right, comes and goes.
Comes and goes. All right. So along with that, have you noticed that your stools have changed color?
Yeah, actually, I've noticed that my stools are turning a bit grey and pale.
Mm-hmm. And with that, have you noticed that your urine's become a bit more darker than usual?
Oh yeah, it's almost like Coca-Cola color sometimes.
Okay.
Yeah.
All right. And any itchiness anywhere?
No, I'm not feeling itchy.
All right. So just going on into a few more questions. Do you have a past history or any family history of blood-related disorders like thalassemia or sickle cell disease?
Not that I know of.
Have you traveled anywhere recently?
No, not with lockdown.
No. Awesome. And have you been feeling tired or weak at all?
No, not that I. No.
Okay. Are you sexually active?
Well, I've been married to my husband for about 10 years now.
Mm-hmm.
10 years.
All right.
And we're trying to have a kid, so yes.
Okay. And do you drink alcohol?
Just maybe 2 drinks, 2 glasses of wine at the end of the week.
Okay. How about smoking? Do you smoke?
No, not at all.
No. And do you use any sort of IV drugs or inject anything?
Oh goodness, no.
No. Okay. And any sick contacts recently?
No.
No. Have you noticed any sort of swelling anywhere around your body?
No, I haven't.
No. And any headaches or confusion?
No, definitely not.
All right. And do you have a past history of gallstones?
No, I don't even know what that is. Yeah.
Okay, so they're just basically stones that can develop in your gallbladder.
Yeah.
But so there's no history of that?
Mm-mm.
No. Any family history?
No.
Okay. So just moving a bit further on, have you been hospitalized before?
Never.
No. Any surgeries or procedures?
Nope.
No. Are your vaccinations up to date?
Yes.
Yep. Do you have any sort of allergies?
No.
No. Any medical conditions that you have?
No. Oh, actually, no. Wait. I have high cholesterol.
High cholesterol?
Yep.
Okay. And do you take any medications for that?
Yeah, I take some statin thing.
Okay.
Yep.
And any family history of any medical conditions?
No.
Right. And can you explain, just give me a brief outline of what your diet is like?
Well, I've been attempting to lose weight.
Okay.
I am, as you can see, quite a big lady.
Mm-hmm.
So in the past, I used to eat out all the time.
Yeah.
But now, I try to get my 3 veggies and, like a bit of carbs and a bit of meat on a plate.
Okay. And that's really good. I think being healthy and having a good diet is really good. So good on you for doing that.
Thank you.
Are you also physically active?
Look, I try to be as physically active as I can.
Mm-hmm.
I'm a businesswoman, really, really busy most
Yeah.
of the time. I'm trying to start my own company, to be honest, at the
That's
moment.
cool.
So, look, if I can go for a walk, I
Mhm.
count myself lucky.
All right. That's good. So those are all the questions that I had to ask you. Do you have any questions for me, or would you like to tell me anything that I may have missed?
Oh, I just want to make sure, it's not like hepatitis. I've Googled it.
Yeah. Well, looking at what I think is going on right now, based on your symptoms, you don't seem to be in a lot of pain. You don't have a fever. The pain is coming and going. I think it's unlikely to be hepatitis, given your picture. I think it's maybe something more down the line where there's some sort of obstruction somewhere.
Mm-hmm.
But again, I can't be 100% sure. I'd have to do some investigations to confirm that and do some more tests. But I think looking at the whole clinical picture from just the history, I think it's less likely to be hepatitis.
Well, thank you so much, Dr.
All right.
Simran.
No worries.
You've been great today.
Thank you.
Thank you very much, Simran. So now I will be moving on to the examiner's role, and I've got 3 questions for you today. So, Simran, the medical team has ordered a liver screen, and they've asked you to interpret the following: LFTs, INR, and pancreatic enzymes. The results are the following: bilirubin is 60, ALP is 650, GGT is 400, ALT is 87, albumin is 32, INR is 1.1, lipase is at 100, and amylase is at 78. Please, can you tell me, and Nicole, what's sort of happening?
So, Nicole, I've got your results here and I can show them to you right now and we can walk through it. So looking at this, I can see that the bilirubin is slightly elevated at 60. The ALP and GGT levels, which are markers, basically tell us whether there's any sort of obstruction, are really elevated at 650 and 400. ALT is also elevated at 87, which is basically an enzyme that's released by the cells in your liver, but it's not as elevated as your ALP and GGT. Albumin is at 32, which is within normal ranges. INR is 1.1, which is also within the normal range. Lipase and amylase are both enzymes that are released by the pancreas, and they're slightly elevated, but they're not too elevated for us to be concerned at the moment. So from what I understand is I can divide these results into the synthetic function, the cholestatic picture, and the hepatic picture. So the synthetic function is intact because the albumin and the INR levels are normal, which are basically markers of products that are produced by the liver. The ALP and GGT is markedly elevated, which tells me that there's some sort of obstruction in the bile duct. So this is in line with an obstructive picture, which also matches your presentation where you've noticed that your stools are pale and your urine is dark, and you've got some intermittent pain in your on the lower side of your ribs. Lipase and amylase are slightly elevated, which suggests a mild pancreatic leak, but it's not high enough for us to suggest that it's pancreatitis.
Thank you very much, Simran. Your second question is, what is the next test you would like to order?
So the next test I like to do is a liver ultrasound.
Thank you. And your third question is list the likely diagnosis as well as 3 differentials.
So I think the most likely diagnosis is choledocholithiasis, which is a gallstone in the bile duct. Other differentials could be any sort of external obstruction, such as pancreatic cancer, which I think is unlikely because the classic presentation is painless jaundice. It could also be something autoimmune like PBC or PSC, but that's also unlikely because there's no sort of history or family history of autoimmune diseases that would increase the risk. But again, I would consider that in my differentials.
Thank you very much. Well done.
Awesome. All right.
How did you feel that was?
I think overall it was. How long did I actually? What was the timing?
So we just got it around. Okay, so the history took around 6 minutes and 30 seconds, so that's fantastic.
Okay.
And then in total, it took around 9 minutes.
All right. So I guess before I begin talking about it, I think I do want to preface it by saying that even though I took 6 minutes and 30 seconds, you may not have that much time during the actual OSCE.
Yeah.
So I guess just time management is something I guess I'll need to learn as well.
No,
but I think we touched it pretty well.
Yeah.
So I think overall it went well. I think one thing I do want to say, which I forgot, was confirming the name and the age of the patient, which I didn't do. So just keep that in mind when you're taking the history. Yeah, but overall I think I got all the information I wanted to get the diagnosis.
Yeah, that was fantastic. That was really nice to see how your style of OSCE. So
yeah, I hope it helped.
I'm sure one day you'll get to hear my style of OSCE as well. But yeah, let's talk about before the OSCE, because as you know, we all have 2 minutes to plan.
Yeah.
What do you do?
So usually what I do is I'll read the stem and I'll say, okay, the presenting complaint in this case is jaundice. What are my differentials? And what I find really helpful is dividing it into whether it's an obstructive picture, so post-hepatic, a hepatic picture, or a pre-hepatic picture. So my main differentials would be cholangitis and choledocholithiasis as a post-hepatic differential. In terms of a hepatitic differential, I think of hepatitis, so viral hepatitis or autoimmune, and drugs. And pre-hepatic, I think hemolysis. So hemolysis due to any reason, whether it's an infection like malaria or any sort of blood disorder like thalassemia or sickle cell. So that's kind of the main structure that I use in the 2 minutes. And then if I have time, I'll write a basic structure. So I'll write down history of presenting complaint, I'll write WWQQAA, write down associated features, just those little words. And then I'd write differentials, systems review, and extended history. And then in the extended history, I'll elaborate on smoking, drugs, medical history, allergies, all that stuff.
Yeah. Oh, yeah. Cool. That's really good to hear.
Yeah.
And then, I know as a third year medical student, it was really confusing when you got to the systems review part because you just started thinking about all different parts of the body.
Yeah.
Could you maybe guide us on how you picked your system review questions?
So in my systems review, I lumped that into, so in this situation, I did, in my systems, I thought hepatitic, so pre-hepatic, hepatic, and post-hepatic. I also thought about other sort of systems that I wanted to consider, which I actually didn't get time to ask, but I'd think about gastro, like diarrhea, nausea, vomiting, abdominal pain. Neuro, so I asked about, headaches or changes in memory. Renal, so changes in urination. So those are other systems that you can ask. And also autoimmune, you want to consider, like, do you have any history of celiac disease or IBD? Honing a bit more down into the systems review for this OSCE, I mainly focused on pre-hepatic, hepatic, and post-hepatic. Mm-hmm. And the way I structured it was I kind of merged it together into the history of presenting complaint.
Right.
So my extension of the history of presenting complaint is a systems review. So once I've gotten a basic history of presenting complaint, WWQQAA, what's going on, I'll go into the associated features. Mm-hmm. Under associated features, I'll ask all my red flag questions. So like loss of appetite, nausea, vomiting, fever, chills, rigors, any weight loss, cover those bases. And then I'll go into more detail into the systems reviews. So I'll ask about, do you have any tummy pain? And if you have tummy pain, I'm like, okay, this is more, and if it's right upper quadrant, I'm like, okay, this is more either hepatic or post-hepatic, unlikely to be pre-hepatic. Then I'll ask, okay, I'll get more of a history about the tummy pain. Like, can you describe it? Is it constant? Is it intermittent? How painful is it? Does it come and go? That just gives me a better picture of what kind of pain it is. Once I've gotten that, I then go, okay, what question can I ask to determine whether it's hepatitic or post-hepatic? And so I asked if you had pale stools, dark urine. Since you had pale stools, dark urine, I'm like, okay, you've got right upper quadrant pain, you've got pale stools, dark urine. That's a post-hepatic picture. And in my mind, I've already gotten my differential diagnosis just in that main history within a complaint and those basic screening questions. And then if I have time, I'll ask other questions just to kind of make sure I've covered my bases. So pre-hepatic, I asked about family history of thalassemia, sickle cell, any travel. With travel, I'm thinking about malaria. And even with hepatic, I asked about, have you traveled? Do you smoke? Do you drink alcohol? Are you sexually active? Do you use any IV drugs? Those are all the risk factors for hepatitis. So I've covered those bases. And then post-hepatic, I asked you about, in addition to the pale stools, dark urine, I asked if you have a family history or a past history of gallstones. Because if you did, then that could also tell me that, okay, maybe you've got a recurrent episode and maybe there's a gallstone that's managed to get its way into the bile duct and get clogged. So those are kind of like, that's kind of the approach that I use. And then once I've gotten enough information, since we're also limited on time, I'll go into the extended history. So hospitalizations, procedures, surgeries, are your vaccinations up to date, any allergies, medical history, medications, basic drug history. I already got that from you by in my systems review. And then I'll ask simple questions about family history, and then a bit of a touch on social. So the reason why I asked you about being physically active and your diet was because if you're, that was also thinking about any risk factors that could increase your risk for gallstones.
Yes.
Yeah.
Okay.
So that was the basic structure that I used.
Yeah, that's really good. Really good tips. So it almost sounds as if in order to get a good jaundice history, it's particularly important and I guess unique that you got to get a travel history, a family history.
Yeah.
I guess past medical history and medications is always really important.
Yes.
But it's probably one of the few times where you do need to ask about sex and going overseas and making sure you ask about whether they had sex overseas.
Yes.
And what kind of food or water they had. And of course, what country they went to as well.
Yeah, absolutely. And I think this is also a really good learning point because if you did say that you did travel somewhere, I would have asked you those questions.
Yes.
So it's really important to make sure that if you get any relevant positive information from the patient, that you explore that further and get a bit more information to get a better picture.
Yeah. Okay. Well, thank you very much, Simran. Is there anything else you would like to tell us?
I just want to say that this is just a system, the approach that I use, and obviously it's not a universal approach. Do what works for you. This is just there to give you some guidance and give some perspective, and I'm hoping that this gave some information. Also keep in mind that it's a 6-minute OSCE. It might even be shorter, like 5 minutes. So you may not be able to get all the information and ask all the questions that you want to ask or that you would have asked in a history when you're actually talking to a real patient. So just keep in mind, like, what's your bread and butter? What are the main questions you want to ask to get to your diagnosis? Because at the end of the day, all the questions you're asking are to help you get the diagnosis and get the overall picture. So just structure it based around that and just think and use that to kind of guide your studying.
Sounds fantastic. Thank you so much for those good tips and studying tips as well. So that brings us to the end of the episode. I think the next episode we shall be talking about LFTs.
Yes.
And then we might start diving into hepatitis as well as liver diseases. So thank you very much once again for listening. We'll see you next time.
Awesome. See you guys.